Diabetes is a serious chronic disease, but even after a diagnosis, for many people, making immediate and drastic changes to their diet and their exercise can seem intimidating, even impossible. And many try to do it alone. In today's Health Matters, one woman shares with us what it took to turn her health around.
Gradually, these numbers were just climbing and climbing and climbing and climbing.
Several years ago, during a checkup, Archana Acosta says her doctor came back with a diagnosis. She had type 2 diabetes.
I just immediately started crying. I was so devastated. I was so upset.
At the time, Acosta and her husband were focused on starting a family. In 2017, she became pregnant, but soon suffered a miscarriage. But she admits even after that devastating experience, it was several months before she prioritized dealing with her chronic condition.
It didn't, and it probably should have. Really, it started when I joined up the UT Physicians group.
Her diabetes was unfortunately out of control at that point.
Acosta connected with endocrinologist Dr. Neel Shah.
But she threw a bombshell at me, which was she wanted to get pregnant. And so on top of all of those things, she said, I want to get pregnant in the next 3 to 6 months. Can you help me?
With renewed motivation and the help of Dr. Shah and a diabetes educator, Acosta was able to lose 30 pounds in about 6 months.
I had to get on the medicine. I had to do all of the weight goals. I had to do all of the eating goals,
allowing her to focus on her original goal once again.
We tried for just 2 or 3 months. It was like 3 months. And then we were pregnant essentially naturally.
In November of 2021, she and her husband welcomed their little girl. Acosta encourages others who are also trying to manage their diabetes to find a support system that works for them.
I had been trying to manage it by myself for many years and begged to be able to do that, even before I saw Dr. Shah. And it wasn't working, right? It was mentally, I thought it could work, but it really wasn't working. And so I really needed the help of a professional.
For more on our series with UT Physicians, go to khou.com/healthmatters.